Hi, everyone. This is Sean with MassSupport Network here with your COVID-19 update for Friday, November 20th, 2020. So let's get right into it. As case counts continue to rise around the world, we saw a total of 4.2 million new cases worldwide in the last week, bringing us to over 57 million infected people around the world. Here in the US, we saw a record of 1.2 million in the last week, which was nearly twice what it was the week before. As that just continues to skyrocket around the country. And here in Massachusetts, we saw 18,000 new cases, which is bringing us past the case counts that we saw in the spring, although that is slightly unrepresentative because in the spring we did not have the testing apparatus we do now. In terms of deaths, the world saw an additional 68,000 people die from COVID-19, which is a jump of about 8,000 people over the week before. Here in the United States, that was 10,000 almost new deaths, almost 3,000 more than the week before that. And here in Massachusetts, 193 people died from COVID-19, which is about 36 more than it was the week before. The smaller numbers don't sound as big, but that is still a significant jump from where we were just a week ago. So looking at the graphs here, everything is still trending up at the moment. Hospitalizations have reached a new high, almost 80,000 people in hospitals across the United States. That is basically about 20,000 hospitalizations over the previous highs we saw even at the worst days of the spring pandemic. You can also see that deaths have risen a lot, and we are at our highest daily death rates since early May at this point, and things are likely to get worse. So let's look at where this is all happening. This is just a snapshot of new cases just yesterday, or excuse me, the day before yesterday. As you can see, this is raw case counts, not adjusted for population. So a smaller state like, for example, Wyoming there, which doesn't appear to have a lot, that is still a lot by their standards. You can see that band from New York to Minnesota of states with over 5,000 new cases per day, and also the larger places, Texas, Florida, California, also that big spike there in Kansas yesterday. And there's just really not a lot of places that are light right now that are not very small, like Vermont, which is itself seeing a significant uptick. So looking at this over the last couple of months, this is the weekly average of cases adjusted for population in the 4 US Census regions. And you can see where we hit the high point of the summer surge in the south and the west in July there. So we hit those highest numbers there. But now you can see that we are at that point again here in 3 of the 4 areas, whereas the Midwest is by population accounting for the rest of the country combined in terms of number of cases. You can just see how it's really skyrocketed there in the last couple of weeks. But it's also important to know where the rest of the country is now as compared to the Midwest, and we're only 3 weeks behind them, really. We could be seeing this kind of growth everywhere else in just a couple of weeks if trends continue like they are, and this should serve to warn us about what is coming for the rest of the country if we don't adjust for that shortly. For example, this is a graph of just the Northeast showing the cases in red as a 7-day average of new cases, and the 7-day average of deaths in gray there. So we saw the deaths peak there. First, the cases peak in early April and the deaths shortly after, as they tend to lag after the diagnosis, and both drop off. But now, if you look where we are here, you see how our cases have skyrocketed to worse than they were before in in April and May, and now deaths are starting to uptick as well here. And you can see from the beginning there what the lag time between cases and deaths was back in the early days, how it almost is a perfect little arc there matching each other. And we have flattened that curve with a lot of the developments we've made in treatments and procedures and just understanding the virus better. So it probably will not spike as sharply, but as these case counts grow and as hospitalizations go up, we're just not going to have the resources to handle that. And speaking of hospitalizations, this is a snapshot from earlier in the week. This is from the 17th, so several days ago, showing the hospitalized per million people. And any state that's in that dark purple there is at its highest record hospitalizations for the pandemic. So you can see that was a lot of them, and that was 4 days ago, just about. So this is really important just to show where the hospital capacity is really being stretched lately. And you can also look on the right side of the chart at the census regions and show how that's split across the different areas of the United States, how the Midwest has, maybe more than half of its states are at the highest point their hospitals have ever been. And that's only likely to get worse as this goes on because case counts are continuing to go up without plateauing. Another look at this here is this is not the number of total hospitalizations, but this is the number of new admissions, this is new hospitalizations by day by these regions. And this just goes back to August with the end of the summer surge. As you can see, when the South was kind of going down, there's sort of this, these are individual days, there's not an average there, so it tends to bounce up and down a little bit. But you can see how the new hospitalizations have gone up steadily everywhere. So this is just going to keep adding on to it. We should keep seeing these trends go up with us here in the Northeast and the West, which maybe we're not doing as badly, are going to start to see a lot more. And how the Midwest, if they're seeing, almost over 3,500 new hospitalizations every day, what that's going to be doing for especially those rural hospitals. Okay, so let's move on to developments because there's actually a lot of good news this week, despite the rising case counts, hospitalizations, and deaths. We have seen some positive news coming up. So the first bullet here is not that great. New York City is closing its schools. Yesterday, they closed in-person schooling due to the rising case counts. Approximately a third of New York City students were attending some in-person school. It was the sort of the largest experiment in keeping schools open in the country. But due to case counts going up, the schools are now being closed. Now, this has generated a bit of controversy as there is still restaurants and gyms open in New York City. And there's been some reporting that the actual case counts within the schools themselves are still very low, but the state government is moving to close down the schools to prevent that form of spread. However, also this week in terms of schools, UNICEF released a report saying that school closures do not reduce community spread. Actually, France has managed to turn its second wave downwards a bit while keeping the schools open. So there's a lot of controversy around school closures right now. In other news, the CDC, in one of its first briefings in months, really, came out with a recommendation saying do not travel for Thanksgiving. Now, it was a very, very clear directive from the CDC, and this is kind of positive news as well because some people are saying it shines that the CDC is kind of getting finding its footing again after some time where it hasn't been able to put out a lot of messaging recently. So this has been encouraging. People are saying that maybe the CDC is going to be able to start taking a bigger role again shortly. And this is a very direct recommendation to try to stop the spread coming up from the upcoming holiday. The recommendations essentially say don't leave your area. There's just too much risk of moving the virus from place to place. Also the risk of traveling itself, plus also being in a group with people from different areas just makes the risk too high. But in more clearly good news, the FDA has authorized the first at-home rapid test. There are at-home tests currently, but they're the kind that you basically swab your nose or mouth, put it in a test tube, and send it off to a lab for processing. This is one that you actually do entirely at home yourself. It'll give you results in about 30 minutes. Now, it still looks a little bit cumbersome at the moment. You have to swab your nose, put the swab in a vial with some chemicals, drop some drops of that onto a strip, but it is a step forward there. It also requires a prescription, which is perhaps one more step than would be preferred to get that rapidly out to people, and is projected to cost around $50. But this is just kind of the first step in a road towards a lot of cheap, widely available rapid testing, which would change the way that we handle testing and identifying COVID cases, which would be huge. But here's some really good news. COVID immunity could last for years. This was a new report. Now, during the early days of the pandemic, there was a lot of concerns that COVID immunity might not last very long at all. Then we got a report that it should be lasting at least 3 months. And now some new studies looking at various blood elements beyond just the antibodies that we've generally been talking about suggest that immunity could be very long lasting. This is especially good news for vaccines, because vaccines typically produce stronger and longer lasting immunity than regular infection does. So with this, combined with the good vaccine news we've received this week, means that we could have some very positive news coming shortly. When we actually get our vaccines out there, people could be protected for a very long time. And speaking of good vaccine news, there's even more this week. Pfizer re-evaluated its efficacy numbers. Remember that Moderna released their numbers on Monday with a 94.5% effectiveness estimated for their vaccine. Pfizer previously said 90% or higher. They've now targeted down to 95% effectiveness, which is huge. That is the same effectiveness as like the smallpox vaccine, which is amazing. Now, of course, these numbers will probably trend down a little bit once we actually get them into the general population, but this is still a very good starting point. They also have been showing good results in older populations. Pfizer reported that in older populations, it was a 94% effectiveness, which is also important because not all vaccines work as well in older people. Also, AstraZeneca is another front runner in the vaccine race and is reported to be having some early results soon, has also stated their vaccine is showing similar effectiveness in elderly people. So that is huge, because in addition to having less effectiveness from vaccines, the elderly people are, of course, at the most high risk from serious cases or death from COVID-19. So these are some huge positive developments in a week where we've reached our highest case counts ever. Right. And you can look into some of this data that I've pulled out here from the COVID tracking project for all those lovely graphs and charts, the New York Times for the raw numbers, and mass.gov for the Massachusetts side. For more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.